We're going to be doing the primary survey. We're going to look for the general impressions of the patient's conditions, and that includes severe bleeding. We're going to check if the level of consciousness, if they're alert, verbal, respond to pain, or unresponsive. We're going to do the ABC, so we're going to check the airway, check the breathing, and their circulation. And if they're unconscious, we're going to open the airway and look for something, for a blockage. We're also going to check, we're going to listen for breathing and check pulse. If they're conscious, we're going to check their respiration, check the rate and rhythm and quality of breathing. So we're going to look and listen and feel for breathing. So he's breathing. We're going to look for the rise and fall of the patient's chest and abdomen. Breathing. And we're going to listen for sounds as the patient inhales and exhales. So when he inhales, we're going to listen, and exhales, we're going to listen as well. And then we're going to count the number of breaths in 30 seconds. So 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, 10 Mississippi, 11 Mississippi, 12 Mississippi, 13 Mississippi, 14 Mississippi, 15 Mississippi. You can count to 15 as long as you count the number of breaths and multiply it by 4. And then we're going to check the circulation of their blood. So we're going to place 2 fingers on the top of a major artery. And if they're unconscious, it's on their neck. And if they're conscious, it will be on their wrist. And you just count the number of beats in 30 seconds. Or again 15 seconds, and multiply your findings by 4. So 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, 6 Mississippi, 7 Mississippi, 8 Mississippi, 9 Mississippi, 10 Mississippi, 11 Mississippi, 12 Mississippi, 13 Mississippi, 14 Mississippi, 15 Mississippi. And then you're gonna check the skin for a look and feel. So you're gonna check their color and see if they're pale, or flushed or pink. You're going to check their temperature, see if they're hot or cold. You're going to check the moisture of their skin, if it's dry or moist. And then you're going to check their capillary refill, which will be in their fingers, and trying to see how fast the blood rushes to their back into their hand. And then of course you're going to record all of your findings.